Let's talk about one of the most important pieces of surgical care, the preoperative assessment. This is where we uncover every risk factor, every comorbidity, and every detail it might affect how a patient responds to surgery and anesthesia. The goal is simple. We want the patient entering the OR in the safest, most optimized condition possible. The preoperative period is all about reducing risk and setting the patient up for a strong recovery. A good assessment helps us predict complications, correct what we can, and individualize the anesthesia and surgical plan. We look at anything that might influence how the body handles the procedure: medical issues, physical limitations, emotional and behavioral factors, even social concerns. Mobility, airway anatomy, medications, nutrition, respiratory function, smoking, alcohol use, and genetic predispositions all play a part. Some conditions raise the risk for complications, and these are the red flags we have to identify early. Arthritis and limited mobility can affect positioning and safety. Cardiovascular disease, past heart attacks, heart failure, arrhythmias, hypertension, and bleeding disorders all change how the patient responds to anesthesia. A history of prosthetic valves or blood clots calls for additional precautions. Endocrine disorders like diabetes, thyroid problems, or adrenal dysfunction increase risk as well. Frail older adults or very young children, patients who are obese or severely underweight, patients with liver disease, immune problems, current infections, renal disease, cognitive disabilities, or neuromuscular limitations all require tailored planning. Even low socioeconomic status can influence postoperative outcomes because of limited access to follow-up care. Every one of these factors affects how we monitor, medicate, position, and prepare the patient. A complete medication history is essential. We review prescription drugs, over-the-counter medications, herbal supplements, vitamins, and recreational substances. Many patients don't realize that natural doesn't always mean safe. Herbal products can influence clotting, blood pressure, heart rhythm, and anesthesia response. People often forget to mention them unless we specifically ask. We also review all allergies, drug allergies, food allergies, adhesive reactions, and possible latex sensitivities. A patient who says they're allergic to bananas, kiwi, or that they can't blow up balloons may have an undiagnosed latex allergy, which is a major perioperative risk. Even though many surgical environments are latex-free today, precautions still matter. Latex allergies can cause rashes, asthma attacks, or full anaphylaxis, so we use latex-free equipment, avoid powdered gloves, clean rooms thoroughly between cases, and alert the entire team. Another major part of the assessment is screening for obstructive sleep apnea. OSA is often undiagnosed, especially in patients coming in for elective procedures. We use tools like the stop-bang questionnaire to identify snoring, daytime fatigue, observed apnea, hypertension, elevated BMI, increased neck circumference, and male gender. Identifying OSA early dramatically reduces airway complications and post-operative respiratory events. We also screen for interpersonal violence. Intimate partner violence can affect anybody, at any age, in any demographic group. Any concerning findings are documented and escalated according to policy. Safety is always part of the assessment. Nutrition and fluid status play a huge role in recovery. We look for obesity, malnutrition, recent weight changes, and vitamin or mineral deficiencies. Some medications affect nutrient absorption. We also confirm NPO status and check hydration. Long fasting periods, bowel prep, and pre-surgery anxiety can all lead to dehydration, electrolyte issues, and low blood pressure. Certain nutrients are especially important for wound healing: protein for collagen formation, arginine for immune support, carbohydrates and fats for energy, water for homeostasis, vitamin C for capillary strength, the B vitamins for metabolism, vitamin A for immune function, vitamin K for clotting, and minerals like magnesium, copper, and zinc for enzyme and collagen activity. If any of these are lacking, healing slows down and infection risk increases. Dentition is another key detail. Loose teeth, decay, dentures, and partial plates can become dislodged during intubation and block the airway. Poor oral hygiene can be a hidden source of infection. All of this needs to be identified long before the patient reaches the OR. Alcohol and drug use also matter. These substances change how the patient responds to anesthesia, influence heart and lung stability, impair wound healing, and increase the risk of infection. Withdrawal is another concern. Patients who arrive acutely intoxicated face significant dangers, and their elective surgery may need to be postponed. In emergencies, anesthesia modifications are made, and extra airway protection, such as NG decompression, may be needed. Because patients sometimes hesitate to disclose substance use, nurses ask directly, but without judgment. Respiratory status is always part of the assessment. Patients are taught deep breathing, coughing, and incentive spirometry. Elective surgeries are often postponed if the patient has an active respiratory infection. Smoking increases the risk of poor wound healing, infections, blood clots, and pneumonia. The preoperative visit is a perfect time to encourage smoking cessation. Some surgeries, especially those involving implants, may even be delayed if the patient continues to smoke. We also evaluate cardiovascular status. Conditions like heart failure, shortness of breath, arrhythmias, and uncontrolled hypertension increase perioperative risk. Baseline vital signs, chest x-rays, and ECGs provide safety data. Surgery may be postponed if cardiac instability is found. The liver and kidneys are central to metabolizing and clearing anesthetic agents. Acute liver disease carries a high mortality rate and must be optimized before surgery. Renal dysfunction may be a reason to delay elective procedures unless surgery is urgent or required to support dialysis. Endocrine disorders add another layer. Thyroid issues increase the risk of respiratory failure or thyroid storm. Adrenal insufficiency, especially after steroid use, can make the body unable to respond to surgical stress. Diabetes affects glucose control, wound healing, and infection risk. Tight glycemic control improves outcomes, so blood glucose is monitored before, during, and after surgery. Immune function is evaluated by checking for infection, fever, allergies, and past adverse reactions. Elevated white blood cell counts or an abnormal urinalysis may require postponing surgery. Certain medications also influence surgical planning. Corticosteroids can cause cardiovascular collapse if stopped abruptly. Diuretics may trigger electrolyte imbalances that increase the risk of respiratory depression. Phenothiazines may cause severe hypotension. Tranquilizers, anticonvulsants, thyroid hormones, insulin, anticoagulants, and opioids all require close review and sometimes adjustment. A complete medication history, including OTC products and supplements, is critical. Herbal supplements deserve special attention. Many natural products cause serious surgical risks. Ephedra increases blood pressure and heart rate. Garlic, ginkgo, ginseng, and high-dose vitamin E increase bleeding. Kava, St. John's wort, and valerian prolong or exaggerate anesthesia effects. Patients are advised to stop herbal supplements at least 2 weeks before surgery, following the American Society of Anesthesiologists' recommendations.